Welcome to Infection Prevention and Control, Hand Hygiene, a Frontline Forces Training presented by Superior Health Quality Alliance, or Superior Health. This learning module was developed with the nursing assistant in mind, created specifically for those working in nursing homes and long-term care. The work you do is important, and the care you give to your residents results in a better quality of life and safer care. The great work you do does not go unnoticed by your peers, colleagues, healthcare team, residents, and families. This course will provide an overview of hand hygiene concepts and will build on your current knowledge. Nursing assistants are a vital link in breaking the chain of infection. Why? Because you spend the most time with your residents and have the most contact with them during each shift. Superior Health aims to empower you by increasing your confidence in making the right decisions, knowing when to tell someone what you see, and to break the chain of infection. The purpose of this course is to further your learning and application of these skills to real-life situations. A healthcare-associated infection is an infection transmitted while giving or receiving care. Poor hand washing is a common cause for the transmission of infections. This learning module, Hand Hygiene, will provide an overview of recommended hand hygiene practices. Learning objectives. By the end of this course, you will be able to recite the definition of hand hygiene, recognize potential risks of transmission of infection, recall barriers to hand hygiene practices in healthcare settings, describe when hand hygiene should be performed, determine when it is appropriate to use alcohol-based hand rub versus water and soap, demonstrate proper techniques for hand hygiene. Did you know thousands of patients get infections in a healthcare setting while being treated for another problem? The Centers for Disease Control and Prevention, CDC, estimates nearly 1 out of every 30 patients in a hospital setting get an infection during their hospital stay. This number increases for those who are more vulnerable and frail. These infections can lead to many additional health complications, both emotional and physical, and for some of the most frail, can lead to death. These infections caused by viral, bacterial, and fungal germs commonly lead to bloodstream infections, pneumonia, and urinary tract infection, or UTI. Have any of the residents you've known ever gotten pneumonia, a UTI, or other infection? Have you ever wondered how they got it? It may have been caused by a healthcare-associated infection, sometimes called an HAI. You can help stop the spread of these types of infections. How? The solution is easier than you think. To prevent the spread of infection, it is important to use good, consistent, and thorough hand hygiene. This is the most important practice to prevent the spread of infections. Hand hygiene can also prevent lengthy hospital stays that cost thousands of dollars. Hand hygiene is the responsibility of everyone. Along with the rest of the healthcare team, it is important for you, the nursing assistant, to demonstrate good hand hygiene practices. Hand hygiene is recognized as an important first line of defense. An HAI is an infection a person gets while being cared for by a member of the healthcare staff. The infection is spread during the care. Poor hand hygiene is a common reason for the spread of germs. Germs can also be transferred from our hands to equipment and supplies, which can spread to others if the infected object comes in contact with that person. What this describes is passing or transferring bacteria from one person to another. This is cross-contamination. Cross-contamination can result in infections that can be especially hard on residents who are vulnerable and have weakened resistance to infections. Cross-contamination can result in UTIs, lung infections, wound infections, and infections that enter the bloodstream. Infection prevention and control practices, including good hand hygiene practices for healthcare personnel during the coronavirus 2019 or COVID-19 pandemic, are more important now than ever. According to the CDC, hand hygiene is an important part of the U.S. response to the preventing and controlling of COVID-19. Practicing hand hygiene, which includes the use of ABHRs, or alcohol-based hand rub or hand washing, is a simple yet effective way to prevent the spread of infections in healthcare settings. Did you know that the transfer of germs or infections between you and the resident is a major factor in the spread of infection? Although this training is based on the importance of your role as a nursing assistant in the prevention of infection, it is important to understand the role the resident plays in the spread of infections. When caring for residents, not only can we infect them, but they can also make us ill when they cough or sneeze or something like this. Resident hand hygiene is also a very important element in the prevention of infection. Unfortunately, residents may not be aware that they can also spread infections, which is why it is important to assist residents with their hand hygiene and overall hygiene. You have an important role in breaking the chain of spreading bacteria from yourself to a resident and from one resident to another. The easiest and most important action you can take to break the chain of infection is washing your hands. The chain of infection is a common phrase used to describe the 6 main sources or links of an infection. Number 1, infectious agent. This is the infection or the germ. Number 2, the reservoir, where the germs live and multiply. Number 3, the portal of exit, how the germs get out. Number 4, mode of transmission, how the germs get around. Number 5, the portal of entry, how germs get in. And number 6, the susceptible host, the person exposed to the germ. Breaking just one of these links can help reduce the risk of infection. Covering a cough, cleaning and disinfecting surfaces, and social distancing are simple ways to do this, but hand hygiene is the most important step to preventing infection. There are many things that can prevent us from performing hand hygiene. Raising awareness of the importance of hand hygiene may promote better practices. Have you experienced barriers that infringe on your ability to perform hand hygiene? Such barriers can include wearing PPE such as gowns and gloves, a high number of touch points such as when you come in contact with an object and then the resident while providing care, hand washing agents or solutions that cause irritation, sinks that are located in out-of-the-way areas, lack of soap, water, paper towel, or alcohol rubs and sanitizers, being very busy, lack of time, or maybe understaffed, resident needs that take priority, lack of knowledge, information, guidelines, or protocols to follow, forgetting to do it, I just did not think about it at the time, do not value the importance of hand hygiene, the disbelief in the ability to stop the spread of infections. Perceived barriers also exist. These are the perceived low risk of transmitting or acquiring an infection from a resident. No one else does it, why should I? My colleagues or supervisors don't do it. It's not a priority here. Hand hygiene is the practice of washing your hands. This includes use of alcohol-based hand rub or hand washing with soap and warm or cold water. Although both are simple, they are very effective ways to prevent the spread of infection when done properly. How does hand washing contribute to the reduction of the spread of infection? Hand washing with soap and water mechanically removes germs by the rubbing, scrubbing action. Scrubbing your hands creates friction, which lifts off dirt, grease, and organisms. It is also important to note when using soap and water that drying hands is also an important step because wet hands are like a sponge for more germs. In contrast to using soap, sanitizers work by killing the germ. The alcohol kills the germs on your skin. When should hand hygiene be done? You should perform hand hygiene before and after all resident contact, contact with potentially infectious material, and before putting on and after removing PPE, including gloves. Hand hygiene after removing PPE is also important because it removes any germs that might have gotten on your bare hands during the removal process. Here are a few occasions when hand hygiene should be performed. After using the bathroom, after coughing, sneezing, or blowing your nose, before and after you eat, anytime your hands are visibly soiled, after providing direct resident care, before and after all procedures, even if on the same resident without leaving the room, after removing gloves, when entering and leaving a resident's room, every time. Healthcare providers should clean hands throughout the resident visit, not just when entering and leaving the resident's room. Keep these additional touch points in mind throughout resident care. Before and after contact with each resident, after contact with blood and bodily fluids, after contact with objects in the immediate vicinity of the resident, after removing PPE, when moving from a soiled or dirty body site to a clean body site during resident care. Alcohol-based hand rub or soap and water. You should perform hand hygiene by using either an alcohol-based hand rub with 60 to 95% alcohol or by washing hands with soap and water for at least 20 seconds. Healthcare facilities should ensure that the appropriate hand hygiene supplies are readily available to all personnel in every care location. CDC recommends using alcohol-based hand rub with 60 to 95% alcohol unless hands are visibly soiled. An alcohol-based hand rub is appropriate in most clinical situations. However, there are certain times when hands should be washed with soap and water. Use soap and water when your hands are visibly soiled, before eating, and after using the restroom or bathroom. As mentioned previously, the CDC recommends an alcohol-based hand sanitizer as the preferred method for cleaning your hands when they are not visibly dirty, because it's more effective at killing potentially deadly germs on hands than soap. It is easier to use during the course of care, especially when moving from soiled to clean activities with the same resident, and when moving between residents in shared rooms or common areas. Also, it may be less irritating on the skin than soap and water. Use soap and water when hands are visibly soiled with blood or body fluids, before eating and after using the bathroom. Are the following hand hygiene statements facts or are they myths? The most important way you can prevent the spread of Clostridium difficile or C. difficile is by washing your hands with soap and water. This is a fact. Alcohol-based hand rub or sanitizers do not contribute to antibiotic resistance. This too is a fact. Alcohol-based hand sanitizers kill germs, including antibiotic-resistant germs, by destroying the proteins and protective outer membrane that germs need to survive. Also a fact. Antibiotic resistance happens when germs like bacteria and fungi develop the ability to defeat the drugs designed to kill them. This too is a fact. Performing hand hygiene should be completed in front of a resident and their family members. Hand hygiene is done to prevent you, the nursing assistant, from getting an infection as well as spreading an infection, and is done ideally at the point of care. Residents expect and should ask the nursing assistant to wash their hands, which increases the compliance of hand hygiene. There is a belief amongst residents that they are at high risk of getting an infection from a caregiver who does not wash their hands. Caregivers can feel comfortable with residents asking them to wash their hands, and because this is a great way to reassure the resident that hand hygiene is being performed. Nursing assistants should also feel comfortable when residents or families ask about hand washing. This helps to ensure that hand washing or hand hygiene is happening. There is a right and wrong way to wash hands. Lathering soap should last for at least 20 seconds. When washing hands with soap and water, follow these steps. Wet hands with warm or cold water. Apply amount of soap as advised on label. Using the right amount matters. If you do not use enough, it will not be as effective. Rub hands together vigorously or energetically for at least 20 seconds, including your palms, back of each hand, between fingers, thumbs, and under nails. Be sure to cover all surfaces of the hands and fingers. Rinse hands with water. Dry hands thoroughly with a disposable towel, and then turn off the tap using a clean or new paper towel. Let's apply what you have learned to the following case scenarios. Mary, a resident at Happy Acres Nursing Home, is incontinent of bowel and bladder this morning, and Lori, the nursing assistant, is preparing Mary for the day, which will include peri-hygiene. Lori gathers supplies and clothing for Mary. Lori dons her gloves and proceeds to wash and dry Mary's face, underarms, and upper body. Lori then removes Mary's saturated incontinent brief and performs perineal care. Next, Lori places a clean, dry, incontinent brief on Mary and proceeds to put on Mary's shirt, pants, and shoes. What should Lori have done before placing the clean brief? If you answered Lori failed to remove her soiled gloves and continued with care, you are correct. In addition to not changing her gloves, Lori failed to wash or sanitize her hands before donning her gloves and after performing incontinence care on Mary. Scenario number 2. Tammy, a nursing assistant, enters the room to assist Henry, a resident, into a wheelchair. Tammy dons gloves and places the mechanical lift sling under Henry and states to Henry she is going to get help to place him in his wheelchair. Tammy takes off her soiled gloves, goes into the bathroom, washes her hands, and dons clean gloves. Marie, licensed practical nurse, knocks and enters Henry's room and assists with transferring him into his wheelchair. After Henry was transferred to his wheelchair, Tammy completes oral care for Henry. Tammy takes her gloves off and exits Henry's room. What step did Tammy miss to help break the chain of infection? Answer: Tammy did not don clean gloves between tasks of transferring Henry to a wheelchair and the procedure of oral care, nor did she wash or sanitize her hands before and after these glove changes. What can you do to improve hand hygiene for your residents? Here is one shining moment a nursing home shared with Superior Health. Sawyer Healthcare implemented a successful See Something, Say Something campaign related to hand hygiene and PPE compliances. They report the staff feel comfortable reaching out to their coworkers on infection control breaches. Recently, a housekeeper approached a therapist and reminded him he should have removed his gloves prior to exiting a resident's room. They shared, if the message is said in the right way in the moment, feedback has helped all disciplines understand their role in keeping everyone safe. Is this something you currently do in your nursing home? If not, can you see yourself giving or receiving this type of feedback to your peers and coworkers? What steps are you taking to prevent the chain of infection to keep yourself and others safe from HAIs? Test your knowledge. Follow the link on the Frontline Forces webpage to the Infection Prevention and Control (IPC) Hand Hygiene Quiz.